Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we're talking about cervical cancer, which is observed in this month of January under the theme Learn, Prevent, and Screen. Joining me on the program today is Dr. Danielle Drapal, the coordinator of the Chronic Disease Unit, and Dr. Michael Pereira, Technical Officer for Hypertension and Cardiovascular Diseases. Welcome to the program, Dr. Drapal.
Thank you for having me, Alicia.
So this year we're observing Cervical Cancer Month under the theme Learn, Prevent, and Screen. And today we want to talk a little bit about some of the ministry's implementations to combat cervical cancer and also monitor those cases across the regions. So could you tell us some of the strategies that the ministry have adopted over the years?
Okay, so as you know, Alicia, we have been doing the VIA screening. But we felt that we have to do a little bit more in terms of screening. So right now we're doing a strategy whereby we're trying to target at least 70% of women between the ages of 30 to 45. So they should be screened at least twice within this age range. So you may have noticed in the budget presentation that some monies has been given for this screening initiative, whereby $8,000 has been allotted for each person to go and get screened. So we're trying very hard to reach everyone. So as you know also that we have a number of sites within the 10 administrative region. As of 2023, we have around 51 sites. This includes private institutions, and in this year's strategy, we're trying to scale up. So we might add a next 45 to 50 more sites, so we could try and attain this goal of screening at least 70% of women.
Wonderful. So persons across the various regions, they can feel free to access a site that is closest to where they live.
And they can check the ministry site. We have placed a number of sites within the 10 administrative regions so they could access anyone that is closest to them. As you know that given our high mortality rate, the cancer registry has given us a preliminary data, and we have discovered that 102 persons died last year of cervical cancer, and this has brought us to the ranking of third, but when more data comes in, it might go back to the second place cause of deaths among women.
And definitely we want to prevent that, especially by cancer, not just cervical cancer, but cancers in general. For women who are still a little bit scared about going and get that VIA done, what would be your advice to them?
Well, it's a very simple test. You don't need to be afraid. My colleague, Dr. Michael Pereira, will describe what it entails. But it's nothing out of the world. You wouldn't be getting any injections or anything of the sort. So later on in the program, we will give you a description of what it entails of having the test.
So I know that the Ministry of Health is working on a policy with regards to cervical cancer. Could you tell us a little bit about that?
Yes, so this policy that we're working on, we're trying to look at different areas in terms of vaccination. As you know that we have HPV vaccine. Yes. For children between the ages of 9 to 15. So we will be expanding in this area. As I mentioned before, screening, we'll be ramping up screening within the regions. Not only with VIA, we'll be doing pap smear and HPV testing within this strategy. And also we're concentrating on treatment. So you know that we readily have available surgeons at the Georgetown Public Hospital. If you need chemo, that is readily available, and radiotherapy and brachytherapy. In the past, some patients may have to go overseas for treatment, but within this strategy, we're trying to bring the service to Guyana, so you wouldn't have to go abroad anymore.
In the month of January annually, cervical cancer awareness is observed internationally with the main aim of raising awareness about cancer of the cervix and HPV vaccination. This year, the focus is on ending cervical cancer within a few generations. In August 2020, the World Health Assembly adopted the global strategy for cervical cancer elimination, which includes a vision of a world where cervical cancer is eliminated as a public health problem. Cancer is always named for the part of the body where it starts, even if it spreads to other parts later. If you're unsure of what cervical cancer is, it may interest you to know that it is a disease in which cells in the body grow out of control. This occurs in the cells of the cervix, the lower part of the uterus that connects the vagina. Cervical cancer is mainly caused by various strains of the human papillomavirus, also known as HPV, a sexually transmitted infection. Some HPV types can lead to cervical cancer over time, while others cause genital or skin warts. Other risk factors may include genetics, having HIV, smoking tobacco regularly, or any condition that makes it hard for your body to fight off health conditions. In Guyana, cervical cancer is one of the second leading cause of deaths among women. Each year, approximately 121 women are diagnosed with cancer of the cervix.
Because of these high stats, Guyana is actually ranked as number 25th in the world in terms of cervical cancer incidence and prevalence. And so because of this, back in 2007, Guyana, the Ministry of Health took on a program of cervical cancer prevention program, because Guyana was actually one of the countries with the highest in the Latin American region with cervical cancer rates. And so we have decided to increase awareness and to launch a cervical cancer prevention program. And back in that year, we adopted January as a month of cervical cancer awareness, really to bring awareness about cervical cancer and encourage persons to come forward to get screened and get tested.
With the adaptation of the cervical cancer prevention campaign launched in 2007, Guyana continues to utilize a three-pronged approach in order to combat and monitor cervical cancer cases.
Back in that year, we started launching the VIA screening program, and also it's a three-pronged approach. One is to increase the HPV vaccination rate, because we know cancer is linked to HPV, and to get the vaccination. At the secondary level, we were doing the screening, that is involved the VIA screening and treatment. And at the tertiary level, to those who were detected with cancer, to get them early treatment and manage the cases. So that is the three-pronged approach. Over the years, we have started with the HPV program. The uptake with the HPV program has not been so good over the years, because we have had a lot of what we call vaccine hesitancy among the population. And this year in 2023, the ministry will actually be relaunching the HPV vaccine. We are trying to actually incorporate it in part of the routine vaccination program for school-age children, and also to push the uptake of HPV vaccine again. Because we know HPV vaccine works. It does help in the prevention of cervical cancer. That's one level. The second level is to get persons screened. More VIA centers is being set up. We need to have more persons trained and to get their persons screened on a regular basis. And at the third level is to increase access to treatment and care for those persons who have been diagnosed with cancer, cervical cancer. So we have the oncology unit at the Georgetown Hospital. We have radiotherapy available for those who have been diagnosed with cervical cancer. But we don't want to reach at that stage. But sadly, what we are seeing is that most of the persons who are detected with cervical cancer again are sometimes in late stage. And you know, this is so sad, because cancer by itself is preventable and is also curable. But once you detect it very early, you can actually cure it, and it can be treated. And so what we are seeing is like the late stage, and when people actually start having symptoms and so on, and then they present. By the time it's kind of, it's kind of late.
While cervical cancer produces no signs or symptoms in the early stages of development, one may experience vaginal bleeding after intercourse, between periods, or after menopause. They may also experience watery, bloody vaginal discharge that may be heavy and has a foul odor, pelvic pain, or pain during intercourse in its more advanced stage. With this, it is highly recommended that women from the age of 21 get a pap test done, and also repeat it every 2 to 3 years depending on the first test results. Women are also encouraged to speak to a medical professional about the HPV vaccine if you're 26 years of age or younger.
For persons, what we recommending is that one is people to stick to one partner. We know multiple partners increase the risk of HPV infection. Two is to get HPV testing done. One is something that we are actually introducing. is to one to start to do HPV testing to know if you're infected or not, because those persons who are infected with HPV know they're at a higher risk, and to get yourself screened on a regular basis. Because not one screening alone, you do one screening and then you're good for the rest of life. You need to do it on a regular basis. There are specific schedules for screening, and you need to follow those schedules. If you screen and you keep getting negative results, you can know it's because if you detect it early changes, you can actually do an early intervention. So those smoking, we know we encourage women not to smoke because there's another additional risk factor that is related to cervical cancer. In terms of the screening, we recommended, the recommendation is that at the age of 21 you should start getting screened, because from the age of 21 that's when a lot of people will actually probably get infected with HPV before in the early age, because we know, like on the last survey that we did, before sexual intercourse among our teenage population is actually by the age of 13. And so screening internationally, you start screening at from the age of 21. If you have a negative test, then you screen you back in 3 years later. Then if after 3 years, if you have a negative, you get 5 years later. So it depends upon if you screen first and you're positive, well, you get back a screening and 1 year later on. So this specific schedule depends upon your results. But we're recommending that persons from the age of 21 start getting screened for HPV or doing the VIA testing.
When screening for cervical cancer, 3 methods are used to determine if any precancerous cells have developed. These include the HPV test, which checks the cells for infection with high-risk HPV types that can cause cervical cancer. The Pap test collects cervical cells to be checked for changes caused by HPV that may, if left untreated, turn into cervical cancer. This will detect precancerous cells that may lead to cervical cancer. A Pap test may also identify conditions that are not cancerous, such as infection or inflammation. The HPV or Pap co-test uses HPV test and Pap test together to check for both high-risk HPV and cervical cell changes. For those of you who are wondering what to expect at a cervical cancer screening, a pelvic examination is usually done, which takes only a few minutes. During the examination, the patient lies on their back on an examination table, bends their knees, and put their feet into supports at the end of the table. The healthcare provider then uses a speculum to gently open the vagina to see the cervix. A soft, narrow brush or tiny spatula is used to collect a small sample of cells from the cervix. In performing an HPV test, the sample is sent to a lab where the cells can be checked to see if they are infected with the types of HPV that causes cancer. When both an HPV test and a Pap test are done on the same sample, this is called a HPV Pap co-test. In addition, the healthcare provider usually provides insight to patients on the examination process to the patient before screening is conducted. Now, let's hear from Anna, a survivor of cervical cancer.
My name is Anna Demores. I'm 58 years old. I have 3 kids. I have 3 grandchildren. I was diagnosed with cancer of the vagina in 2018. One night, I wake up and I go to urine, and when I take the tissue and mop, I see the blood. Next day, I call one of my foundation, the Beacon Foundation, and I told the nurses what I have seen, and they told me to don't put my finger. Then I called my gynae oncologist, and she told me she will get on to an oncologist. I went to him. They did a biopsy. They sent one to Georgetown Hospital. They sent one to Woodlands. And the morning when I get it back, I sit at Woodlands and I open it. And I see all the red markings. I know all the things because maybe it's through the years I've been through this. So I know to read, I guess. Yeah, so my doctor, he said, don't cry. He said, you know what is happening? I say, yes. And I start one scream. I start one screaming. And they say, I have to do radiation, internal and external radiation. So they write up for me to start the radiation. And so sometimes I have to do it at Eureka Lab because Josh Youngstown never used to do it, but now they do it, especially a main test that it costs 15,000. They're doing that, the cancer marker. And so I said, where will I find this money from? I said, God will provide. So I tell my doctor, and she says she's coming and she will let us go to the ministry and put the case forward to social worker, and we put the case forward, and they pay for my treatment at the Cancer Institute. The government pay for that. I only had to find my money. I had to pay for accommodation and different things and different organizations like the Periwinkle. I could call my clubs because I wanted people to know about them. The nurses from the Beacon here, the Giving Hope Foundation, Dr. Godin Foundation, and so everyone showing my family and my church, everybody showing a lot, and they and I go to Suriname. And I did the internal radiation. But before I met to Suriname, I had no cancer. The cancer was gone. But when I meet over there, the doctor said, you still have to do it because with money already paid. You have to do it because we don't want a recurrence. Sometimes get a little emotional. You don't want a recurrence, so I did my internal and external radiation from 2018 to now. I was like 3 months lying on my back in 2018 because I was badly born. But thank God that I'm here, that I have life. But all through the years, in 2028, I was diagnosed with stage 3 breast cancer. Yes, I would tell persons. I work with patients who come to do radiation, and I tell them, family is very important, and friends, because I see through the years a lot of family cancer break up a lot of family. A lot of friends think that when you have cancer that they will catch it. Yes, a lot of people think that when you have cancer they want nothing to do with you and this thing, but in my situation, no, it wasn't like that. But I would tell them to please support, please show them the love, especially if I see this person not gonna make it. I know, right? Make them comfortable. Women out there, I'm appealing to you to get early screening because some persons never even go and do the VIE. Some persons so afraid, but there's nothing to be afraid of. I could tell you, nothing to be afraid of, because early detection saves life.
So during this month and beyond, let us work together to build back healthier communities by improving access to HPV vaccination, screening, treatment for cervical precancer, and management of cervical cancer by 2030, and end cervical cancer within a few generations. Dr. Michael, still on the topic of cervical cancer, for persons who are watching and listening to us even now and they're not too clear about what the cancer is, how it is developed, could you tell us a little bit about that?
All right. So again, we're observing Cervical Cancer Month and we're raising awareness for cervical cancer. So cervical cancer is basically cancer of the cervix, or like the local talk would say, the mouth of the womb. What is basically a part of the part of the uterus that opens into the vagina. So as we would have said, cervical cancer is between the second and third leading causes of death among women in Guyana. And this is why we're promoting the VIA program. So we can have persons screened at an early stage to highlight if they're lesions or precancerous lesions that can later develop into cervical cancer. What are some of the risk factors of cervical cancer? So the risk factors would have to deal with, firstly, having a family history of cancers, especially cervical cancer in your family. This increases your chance about 2 to 3 times of having this illness. Other causes that are linked is, for example, obesity and smoking. While persons who may also have other illnesses, such as who may have immunosuppression, particularly like those who may have diseases such as HIV, etc., because these are illnesses which weakens the system and makes them more propense to this illness. Having a reproductive history of 3 or more deliveries is another risk. And in terms of your sex history or sexual history, for those who would have had multiple partners, who would have started to have sex at a very early age, and persons who would have had a history also, again, of STDs. These are some of the risk factors.
Thank you so much, Dr. Michael. Could you tell us of some of those symptoms that persons may experience? I know of persons who would have had cervical cancer but didn't experience any symptoms whatsoever. Is that possible? And, if persons don't experience symptoms, what can be done? What would be your advice to them?
So the thing about cervical cancer is a very slow-growing cancer. And many times you do not have symptoms at the early stages. And most oftentimes when persons do look out for symptoms, it's already advanced. However, there are a few symptoms and signs that may appear in the early stages that many persons tend to neglect. And after years or a period of time, that's when they may take it into hand, and that's when you already have developed the cancer. This is one of the reasons why we're advocating for early screening, so we can pick up these precancerous lesions before they can actually have the full-blown disease. So what are some of the symptoms? So having abnormal vaginal bleeding. So persons may say there's having streaks of blood coming from there, or they're bleeding outside of their menstruation, and they may not take it for anything. This is one of the causes. Another one, bleeding after you have sexual intercourse. Many persons tend to neglect this one, especially they may say they're bruised or something of that sort, but they'd have to try to be vigilant and, see what's the reason behind this bleeding. Bleeding in between your menstruation, and also having heavy bleeding. So your menstruation comes, you would normally know if it's regular, how long it lasts, and so on, and how many pads you will soak daily. So you may find that in between your time, you may start to bleed again, between your menstrual cycle, and you may observe, okay, instead of soaking probably 2 or 3 pads a day, you started to soak more pads. And this is something you need to alert yourself and notice if it's happening, and then, get yourself screened, get yourself checked. Or having a period that lasts way longer than it normally comes. Many times women may say, oh, my period lasts between 3 to 7 days or something of that sort. And then all of a sudden you see a change in the trend, and you would want to know, why is this so? And lastly, they may have some form of discharge or so on associated. And if it's persistent, you may need to look into it.
For persons who are diagnosed with cervical cancer, what treatment is available for them?
So persons diagnosed with cervical cancer, once you have the full-blown disease, you may have to see your oncologist, where they will determine if you need to go on chemotherapy, radiotherapy, or there are drugs in place that they may want to start with. However, to avoid this is the reason why we are advocating for early screening and advocating for the VIA. Now, the VIA is very simple. It's a painless procedure. And the VIA stands for visual inspection using acetic acid. Now, acetic acid is simply the normal vinegar you have at home. It's just that we will use this. Firstly, we will insert the speculum and we will paint that cervix, the mouth of the womb, as they would say. And we would wait 1 minute after you paint that cervix to see if there's the appearance of these bad cells. I will use the word bad cells, or they can be precancerous cells, because again, cervical cancer is preventable. If the early the diagnosis, and if we see these bad cells or precancerous cells, we can treat them. And the treatment is right there, readily available, on point. Right away you have your treatment. And so far we've had high 90s, probably about 97% rate of those persons who would have had some of these lesions after they underwent therapy. These lesions disappeared after the time when they had revisited the doctor and did their other tests. Now, what we would do with paint that cell, we'd observe for the abnormal, we paint the cervix, and observe for the abnormal cells or the bad cells. If the person is negative, they would repeat their VIA within 3 years. Once they're within that age range, like our coordinator, Dr. G. Powder said, 25 to 49. However, if they're positive and we identify these cells, what we will do, we'd offer cryotherapy. Cryotherapy is basically freezing those bad cells. And I mean, once you freeze something, you would expect, like ice, it would melt at some point in time.
Yes.
So as you freeze this, these bad cells are identified there, as that nitrous gas and so on that we're using, as it melts, it would take away those cells. It would clean up that womb, right? But for those persons who are positive, they would need to recheck themselves after a year of receiving treatment. Also, for wounds that may be very large on the cervix, we would normally refer them to a tertiary institution so they can get a LEAP and for the investigations done. Again, this process takes, 1 minute to get the procedure done, and the treatment is right there. We can treat you right away. Most institutions have cryotherapy and cryo machines there, so we can treat you again right away.
Thank you so much, Dr. Michael.
Cervical cancer produces no symptoms in the early stages, which means every woman should get tested routinely to be detected early. Visual inspection with acetic acid, commonly known as VIA screening, looks at the cervix to detect abnormalities. Diluted solution of acetic acid is applied, and this detects the precancerous lesions before it progresses into full-blown cancer. The VIA process is pain-free, quick and simple, and results in treatment are immediate and free. VIA-positive women can undergo cryotherapy treatment or freezing of the precancerous cells, which takes less than 15 minutes. Remember, VIA is safe even during pregnancy, is free and only takes a few minutes, is suitable for sexually active women. Get screened every 3 years or as recommended by your healthcare provider. A few minutes could be life-saving. VIA screening can be accessed at selected public hospitals and health centers countrywide. A message from the Ministry of Health Chronic Disease Unit.
So before we wrap up the program today, could you tell us about some of the activities that the Chronic Disease Unit have planned?
So we have been ramping up our outreaches. All of the centers who have been offering VIA, they will be offering this, and they will be going out and doing outreaches. And in the month of February for World Cancer Day, we'll be having a mini health fair at the Ministry of Health on the tarmac.
So what can we look forward to as you guys progress through the year?
So as I mentioned before, we will be doing lots of screening because we need to reach our targets. It's very important that each and every female get their HPV test done.
Thank you for joining me on the program today. I'm Alicia Martin saying goodbye for now.